In the next few seconds, I want you to pay close attention to something most people over 60 completely ignore, and it could be the reason your hands feel numb, your feet tingle, or your balance feels slightly off. If any of that sounds familiar, don't dismiss it just yet. Before we go deeper, take a moment to like this video and subscribe to the channel. It helps me continue sharing important health insights that so many people never hear in time. I promise, what I'm about to share could genuinely change the way you look at your health. Now, let me speak to you as a doctor who has spent years working with older adults. I've seen a pattern that repeats itself far too often. People come to me thinking that tingling in their feet, burning sensations, or random weakness in their hands is just normal aging. But in many cases, it is not just aging at all. It is something happening quietly inside the nerves, something that develops slowly over time. One of the most overlooked contributors to this kind of nerve discomfort is a deficiency in certain essential vitamins that your body relies on to keep your nervous system functioning properly. When these nutrients are low, your nerves can become irritated, weakened, and less responsive. The result is that strange pins and needles feeling that many people ignore until it becomes harder to walk, grip objects, or even sleep comfortably. What makes this even more concerning is that early signs are often very subtle. You might just feel slightly off balance when you get up at night, or notice that your shoes feel different on your feet. These small changes are easy to overlook, but they matter more than most people realize. I've had patients tell me they wish they had paid attention earlier, because once nerve discomfort progresses, recovery can take longer than expected. The good news is that when identified early, nutritional support and lifestyle changes may help improve nerve function and overall comfort significantly over time. In the following moments, I want to walk you through what is actually happening inside your body and why one specific vitamin has been studied closely for its role in supporting nerve health, especially after the age of 60. Stay with me, because understanding this could help you recognize early warning signs that many people miss, and it may give you the chance to take action before symptoms become more persistent or disruptive in daily life. Now, let's go a little deeper into what's actually happening inside your body when these nerve-related symptoms begin to appear. Your nervous system is like an intricate electrical network. Every movement you make, every sensation you feel, even your balance when you walk, depends on signals traveling smoothly through these delicate nerve pathways. But as we age, those pathways can become more vulnerable to damage, especially when the body is not getting enough of the nutrients it needs to maintain proper nerve function. One vitamin in particular has been studied extensively for its role in supporting the health of these nerves. What I find interesting in clinical practice is that many people are completely unaware they are low in it until symptoms become noticeable, and by that time, the nerves are already struggling to communicate effectively with the rest of the body. I've seen patients describe it in very simple terms. They say things like, "Doctor, it feels like my feet are asleep all the time," or "I can't feel the ground the same way anymore when I walk." These are not random complaints. They are signals from the nervous system asking for support. What's often misunderstood is that nerve discomfort doesn't always come from injury or disease. Sometimes it develops gradually due to long-term nutrient depletion. This can happen more easily in older adults because the body becomes less efficient at absorbing certain vitamins from food alone. Digestive changes, medications, and dietary habits can all play a role. Now, I want to be very clear here. This is not about fear. It's about awareness. Because when you understand what your body might be missing, you can take steps to support it in a much more informed way. There is research suggesting that when certain vitamin levels are restored, nerve function may improve, and symptoms like tingling or numbness can become less intense over time. But the key is early recognition. The longer nerves remain under stress, the more difficult it can be for them to recover fully. What concerns me most is how often people ignore these early signals. They assume it's just aging, or they wait until the discomfort becomes severe enough to interfere with daily life. By then, simple interventions may not feel as effective as they could have been earlier. In the next part, I want to explain the specific warning signs that many patients overlook, even though their body has been giving them clues for months or even years. Let me ask you something you might not have considered seriously before. Have you ever noticed a strange tingling in your toes at night? Or a slight burning sensation in your feet when you're just sitting quietly? Maybe you've brushed it off, thinking it's nothing important, or told yourself it's just part of getting older. But I need you to understand something important. Your nerves don't usually stay silent when something is wrong. They send signals, subtle at first, easy to ignore, but still signals. One of the earliest warning signs I see in patients is a change in sensation. Not complete numbness, not severe pain, just a difference. The carpet feels slightly off under your feet. Your hands don't grip things quite the same way. You might even drop small objects without understanding why. And here's what most people don't realize. These changes can sometimes be linked to a deficiency in key vitamins that support nerve repair and communication. When the body is low in these nutrients, the protective covering around nerves may weaken over time, making signals slower or distorted. I've had patients describe it in very emotional ways once they finally understand what's happening. They say, "I thought I was just getting old, but something felt wrong." And that moment of realization is often powerful because it means we still have time to intervene early. Another subtle sign is fatigue that doesn't fully make sense. Not the kind that comes from a long day, but a deeper tiredness where your body feels less responsive. You may feel less steady when walking or slightly unsure on stairs, even if your muscles are still strong. This is why nerve health is so often misunderstood. People focus on muscles, joints, or bones, but the nervous system is what connects everything. When it starts to lose efficiency, the entire body feels it in quiet, indirect ways. Now, I want to emphasize something carefully. These symptoms do not automatically mean something severe is happening, but they are worth paying attention to. Because in medicine, early awareness is often the difference between simple support and long-term discomfort. There is growing research suggesting that when certain vitamin levels are restored under medical guidance, nerve-related symptoms may improve gradually. Some patients notice changes in sensation, stability, and overall comfort over time. But the real question is, how early are you catching the signs? Because in my experience, the earlier we understand what the body is trying to communicate, the better we can support it naturally and safely. And next, I want to explain why so many people over 60 are unknowingly at higher risk for this exact kind of nerve-related change, even if they feel healthy overall. Now, this is where many people get surprised in my clinic. They'll sit in front of me and say, "But doctor, I eat fairly well. I take care of myself. How could this be happening to me?" And that's exactly the misunderstanding I want to clear up today. Because nerve-related vitamin deficiency is not always about what you eat in a single day. It's about how your body absorbs, processes, and stores nutrients over time. And as we move beyond 60, the body naturally begins to change in ways most people don't feel immediately. One of the most important changes happens in the digestive system. The stomach produces less acid than it used to, which sounds harmless at first, but it plays a major role in breaking down and absorbing certain vitamins that your nerves depend on. When absorption decreases slowly over the years, the deficiency builds quietly in the background. At the same time, many older adults are on medications for blood pressure, acidity, or diabetes. Some of these can indirectly affect nutrient absorption as well. This doesn't mean the medications are bad, far from it, but it does mean the body may need closer nutritional attention than before. What makes this even more complicated is that the body is incredibly adaptive. It tries to compensate. So for a long time, you might not feel anything serious, no dramatic symptoms, just small changes, slightly slower reflexes, a bit of tingling, occasional imbalance. And because these signs are mild, most people assume it's just part of aging. But in my experience, when several of these small signs appear together, they are often pointing toward the same underlying issue. The nervous system is not getting the full nutritional support it needs to function at its best. I want you to picture your nerves like electrical wires covered in a protective coating. When that coating is healthy, signals travel smoothly and quickly. But when it weakens over time, those signals can become disrupted. That's when people start noticing numbness, burning sensations, or that walking on uneven ground feeling. Now, here's the encouraging part. When we identify these changes early, and when nutritional support is guided properly, the nervous system often responds. It doesn't happen overnight, and it's not about quick fixes. It's about giving the body what it has been missing for a long time so it can function more efficiently again. I've seen patients regain confidence in their walking, feel steadier on their feet, and experience fewer strange sensations simply by addressing these underlying deficiencies under medical supervision. But before any of that can happen, the most important step is recognition. Because what you understand today may prevent much bigger challenges later. And next, I want to talk about the specific vitamin that has been studied most closely in relation to nerve support, and why it plays such a crucial role in how your body feels day to day. Now, let's talk about the vitamin that has been at the center of so much research when it comes to nerve health, especially in older adults. In clinical settings, one group of vitamins that consistently comes up in discussions about nerve function is the B-complex family. And among them, there is one in particular that doctors pay very close attention to when patients report tingling, numbness, or burning sensations. This vitamin plays a key role in helping the body maintain the protective layer around nerves, which is essential for smooth and accurate signal transmission. When levels are low, those signals can become weaker, slower, or even misfiring in certain areas of the body. That's when people start to notice unusual sensations in their hands or feet. What makes this especially important after the age of 60 is that the body's ability to store and absorb this vitamin naturally declines. So even if your diet hasn't changed much, your internal levels might not be the same as they were years ago. I want to be very responsible here and say this clearly. We are not talking about a miracle substance or a cure. We are talking about a nutrient that supports normal nerve function and overall neurological health, especially when the body is under strain. I've seen many patients come in after months or even years of mild symptoms. They often say the same thing. I wish I had taken those early signs more seriously. And what they usually discover is that their levels of this vitamin were lower than expected, which may have been contributing to their discomfort. When corrected appropriately under medical supervision, some people report gradual improvements in sensation and steadiness. Not instant changes, but slow, meaningful progress over time as the nervous system receives better nutritional support. But here's something very important that I always emphasize in consultations. More is not always better. Vitamin balance matters. Taking excessive amounts without guidance can be harmful in some cases, which is why proper evaluation is essential before making any changes. This is also where many people go wrong. They self-diagnose, start random supplements, and expect quick results. But the nervous system doesn't work like that. It responds best when deficiencies are properly identified and corrected in a controlled, consistent way. So rather than thinking of this as a quick fix, I want you to think of it as restoring support to a system that has been quietly under strain for a long time. And now, in the next part, I want to show you the everyday habits that may be silently making nerve symptoms worse without you even realizing it. At this point, many people focus only on what they should add to improve nerve health, like vitamins or supplements. But in my experience, what you remove from your daily habits can be just as important as what you add. because there are everyday patterns that quietly place extra stress on your nervous system without causing obvious alarm in the beginning. One of the most common factors I see is long-standing blood sugar imbalance. Even mild elevations over time can affect the tiny blood vessels that supply your nerves. When those nerves are not getting optimal support, symptoms like tingling, burning, or reduced sensitivity can gradually appear. Many people don't even realize this connection exists until we look deeper into their history. Another factor is prolonged stress. I don't just mean emotional stress, but the kind that quietly keeps the body in a constant, alert mode. When stress hormones remain elevated for long periods, the body prioritizes survival functions over repair, and nerves, unfortunately, are part of that repair system that may get less attention from the body during chronic stress. Sleep is another critical piece that is often underestimated. During deep sleep, the body carries out important maintenance processes, including nerve repair and regeneration. When sleep is inconsistent or shallow, the body simply doesn't get enough time to restore itself properly. Over months and years, this can contribute to worsening nerve sensitivity. I've had patients who were doing everything right on the surface, eating reasonably well, staying active, but still experiencing nerve symptoms. And when we explored further, we found patterns like poor sleep, unmanaged stress, or fluctuating blood sugar playing a quiet but significant role. There's also one more thing people rarely consider: how long symptoms are ignored before seeking help. The nervous system is remarkably adaptable, but it also responds slowly to long-term strain. The earlier we address underlying causes, the better the chances of improvement in comfort and function over time. Now, I want to be clear, this is not about blame. It is not about perfection. It is about awareness. Because once you understand these hidden contributors, you are in a much stronger position to support your body in a realistic and sustainable way. And when it comes to nerve health, small, consistent improvements often matter more than dramatic changes. In my clinical experience, when patients begin to stabilize these underlying factors while also addressing nutritional gaps, they often start noticing subtle but encouraging changes: less tingling, better steadiness, improved confidence in movement. But before we finish, there is one final piece of this conversation that brings everything together: the early action steps that can make a meaningful difference before symptoms become more limiting in daily life. Now let's bring everything together in a way that actually helps you move forward with clarity instead of confusion. Because if you've made it this far, you already understand something very important. Nerve-related symptoms are rarely random. They are usually the result of multiple small changes in the body that build up over time. Nutritional gaps, metabolic stress, sleep disruption, or simple age-related absorption changes. And the most important message I want you to take away today is this: your body often gives early warnings long before more serious discomfort develops. That slight tingling in your feet, the occasional numbness in your fingers, the feeling of being a little less steady when you walk in the dark, these are not things to ignore or normalize without thought. They are signals worth paying attention to. In many cases, when people begin to take these signs seriously early on, we focus on a combination of supportive strategies: balanced nutrition, careful vitamin evaluation, improved sleep quality, and managing blood sugar stability. These are not dramatic interventions, but they are powerful when done consistently. The vitamin we discussed earlier plays a particularly important role in supporting nerve function, but what matters just as much is understanding the bigger picture. No single nutrient works in isolation. The body is a connected system, and nerves respond best when overall health is supported, not just one piece of it. I've seen many patients regain comfort over time when they stopped dismissing early symptoms and started working with their body instead of against it. Not through extreme changes, but through steady, informed adjustments guided by proper medical advice. And I want to say this gently but clearly: If you are experiencing any of the symptoms we discussed, it does not automatically mean something severe is happening, but it does mean your body is asking for attention, and listening early is always the safest approach. There is a sense of relief that comes when people finally understand what is happening inside their body. Instead of fear or confusion, they gain direction, and that alone can make a huge difference in how they feel day to day. So if anything in this video resonated with you, I encourage you not to ignore it. Speak with a qualified healthcare professional, get the right assessments if needed, and take small, informed steps towards supporting your nerve health. Before you leave, don't forget to like this video and subscribe. It helps me continue sharing medically responsible, practical health information that can genuinely support people in their daily lives. And remember this, your body is always communicating with you. The earlier you listen, the better you can support it for the years ahead.